Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast this week. My name is Terry Fletcher. I hope everyone is getting excited for the Christmas day and Christmas season. I know I am. It's one of my favorite holidays, and my daughter gets to come visit me, so I'm very excited about that. So today I wanted to talk to you about, I'm actually revisiting a topic that has come up on my radar again, and the OIG seems to want to publish it all the time, and it was on the National Law Review this morning, so I figured it was time to revisit it. I know we talked about it recently, but I just think it's, as we're going into the new year, it's something that you probably need to have a heads up about. So the OIG has issued seven different national telemedicine and telehealth audits, and companies who feel that the public health emergency waivers and exceptions have rendered telemedicine immune from compliance oversight. You're going to be surprised to learn, and I've brought this up before, what federal regulators have in the works. So that is the OIG at the Department of Health and Human Services, and they're conducting at least 7 different national audits, evaluations, and inspections. I think that's new, of telemedicine services under the Medicare and Medicaid programs. The audits will also review remote patient monitoring, virtual check-ins, and e-visits, which are the online patient portal visits for compliance. OIG previously issued a report in 2018, so prior to the pandemic, on Medicare telehealth billing, and they just used a small sample size because there were so many restrictions as far as the geographic location, etc. But even in that small sample size, they found a 31% error rate of claims did not meet the Medicare requirements for payment of telehealth services. So providers who have begun or increased billing because of the federal programs have been opened up, and the exceptions and flexibilities of the public health emergency has allowed almost for a free-for-all. You should expect those claims to be subject to OIG review. So the OIG published a statement last month on telehealth and fraud concerns, and they explained, and also it was on the February work plan. And here's where they quote. They said, the OIG is conducting significant oversight work assessing telehealth services during the public health emergency. This goal of these reviews is to ensure telehealth delivers quality, convenient care for patients and is not compromised by telefraud. And we've already seen that there's all kinds of things that have been done that have been on the radar as far as a possible OIG review. And so let's just take a look and see what their active work plan is looking at, because they have projects that affect not only Medicare and Medicaid providers, but suppliers, payers, and they're really looking at quite a few different situations and projects originating with the Office of Evaluation and Inspections, which provides management reviews and evaluation of HHS program operations. They're also part of that statistical work plan itself. And so here's what they're looking at. And here's number 1. Audit of home health services provided as telehealth during the COVID-19 public emergency. So in this report, OIG will evaluate home health services provided by home health agencies. And remember, that's for agencies. It's not for a physician who goes to a patient's home. That's completely different. This is home health services that are basically a home health agency function. So they've provided these services during the PHE, and they want to determine which types of skilled services were furnished via telehealth and whether those services were administered and billed in accordance with Medicare requirements. So the OIG will report overpayments, any services that were improperly billed, and they're going to publish this in 2022. So this is right on their website, right on their work plan. And remember, home health services has to have a face-to-face component, which does not include telehealth. So they're saying that to be eligible for telehealth, you had to have seen the patient, and a lot of these agencies did not follow with that. So that's going to be a huge win for OIG and a really bad situation for home health services. So number 2, and this is what's going to affect many of you that are listening to the podcast, because most of us are Part B, I would say, telehealth service providers. So they're going to audit Medicare Part B telehealth services that were performed during the COVID-19 public health emergency. So in this report, the OIG will conduct a series of audits in 2 phases for the Part B telehealth services. Phase 1, audits will focus on making an early assessment of whether services such as evaluation of management, opioid use disorder, end-stage renal disease, and psychotherapy met the Medicare requirements. Phase 2 audits will include additional audits of the Part B telehealth services related to distant and originating site locations, virtual check-in services, electronic visits, remote patient monitoring, and the use of telehealth technology. They're going to really look to see how many of you billed for audio-only services as an office visit incorrectly. And they're going to look at annual well visits to determine whether Medicare requirements were also met, since a lot of that was also done telehealth, which it was allowed to be as long as it was appropriate and under the rules. The home health agency's challenges and strategies in responding to the COVID-19 pandemic. So this seems similar to the home health agency before, but in this report, OIG will provide insights into the strategies HHA have for issuing to address the challenges presented by COVID-19, and then including implementing telehealth to treat patients remotely, addressing staff shortages, and how well their emergency preparedness plan prepared them for the pandemic. So they're going to publish that also in 2022. I think this one will be interesting as far as the emergency preparedness. Nobody was prepared for the pandemic, not at least that I saw, not by any means. So to what extent do you have to be prepared for that? I think moving forward, this is definitely going to be on the radar for the OIG and for Medicare. Medicare telehealth service during the COVID-19 pandemic program integrity risks. So this is pretty much a big one. So this is going to identify program identity and integrity risks associated with Medicare telehealth service during the pandemic. They're going to analyze providers' billing patterns for telehealth services, and will describe any key characteristics of providers that pose a program integrity risk to the Medicare program. So I'm assuming they're going to look at physicians who are coding level 5s or aren't using time and aren't changing their code once. If the patient loses their video connection, they should have changed it back to an audio only code. So this will be an interesting for the program integrity risks. Use of Medicare telehealth services during the pandemic. Now, this one is general. OIG will examine the use of telehealth services in non-institutional services and in managed care during the pandemic. So they want to look at the extent to which telehealth services are being used by Medicare beneficiaries, how the services compare to the same services as delivered in person, and the different types of providers and beneficiaries that are actually using telehealth services, and the efficacy of those services. So how effective is it? Are patients actually able to get the same quality care or at least similar? And if they're not, then why is there a payment parity? That's going to be a huge thing. Medicaid, they're going to look at telehealth expansion during the emergency as well to determine whether or not Medicaid agencies and providers complied with federal and state requirements for telehealth under the National Emergency Declaration. And that will be published in the end of 2021. So we're looking forward to that in December. And then the last one is on behavioral health and Medicaid and managed services. So this was already reported in October and at the beginning of November. And OIG analyzed how state Medicaid programs and managed care organizations, so MCOs, use telehealth to provide behavioral health care. They selected certain states for monitoring and oversight of behavioral health. They actually liked what they saw. And so after the PHE ends, behavioral health and mental health services are actually going to continue under the telehealth just as paid, just like the PHE, but they have some rules on that, which you've probably heard if you got my Medicare update. The patient would have had to have a face-to-face visit 6 months prior to having telehealth services, so they have to be an established patient. And there's also a list of diagnoses under mental health and behavioral health that they'll have to adhere to be able to get telehealth covered. So because the public health emergency triggered rapid growth in telemedicine and remote patient monitoring and other virtual care services, some organizations were better prepared to scale to that than others. And so you may want to look at an internal operational review. You may want to look, I'm not saying hire somebody like me, but you can, to take a look at what your telehealth practice did during this public health emergency. Because if you started billing for remote care for the first time during the public health emergency, you could benefit from conducting a self-assessment to evaluate if you had sufficient compliance safeguards are in place. Do you have a compliance program? Do you have proper HIPAA policies? What platforms are you using? What statements are in the patient's file? Are you complying with Medicare rules under the flexibility 1135 waiver? And also, are your contracts in compliance with fraud and abuse laws? So you might want to consider that. We're available if you need us to help you with that at Terry Fletcher Consulting. So definitely take a look at that, because one of the things that OIG has uncovered is that there's a lot of telefraud schemes out there. They inappropriately leverage the reach of telemarketing schemes in combination with certain unscrupulous physicians conducting sham remote visits to increase the size and scale of their operation, because it's just so easy. And so the OIG has really been looking into this. There's a lot of schemes noted, but sometimes it's hard to distinguish those schemes from telehealth fraud. And so that's why they're studying all this. And that's why once the public health emergency ends, they're not continuing as the free-for-all with the telehealth because of all they call it telefraud. So we have to really see what our physicians are doing. And many of you may want to expand telehealth in the future beyond the public health emergency, because some patients like it. Patients that just need a medicine checkup, patients that just are looking at well checks. Maybe a patient just has maybe one minor problem they need to deal with. But if you've got patients that have palpable masses, chest pain, shortness of breath, potential pulmonary embolisms, potential heart attacks, potential, cancer masses, those are not telehealth visits. Those are visits that need to be in person. And so really, taking some advice and looking at best practices for having a telehealth platform, maybe even a list for patients. This is telehealth, this isn't. And we can help you with that. So keep that in mind. The waivers will eventually expire. I realize we're in a new variant for the Omicron right now, but it's very mild. There's no deaths reported in the U.S. There's only one in England. And that wasn't from COVID. That was with COVID. They had comorbidities and they were 87. And so, I'm not minimizing it. I'm just saying that it's a big difference. But now we know how to treat it. We know how to, people are getting vaccinated. The country is 71%. And the boosters are out. The public health emergency will eventually expire. And so with the waivers, you're going to kind of be hit with a thud, because under the last 2 years, you've been, 2 years under public health emergency, and it's not supposed to end until January. You are definitely probably getting used to certain things. So we don't want you to get a False Claim Act. We don't want you to be overcharging or even undercharging. We just want you to be compliant, best practices, and be able to be scrutinized cleanly if you ever get audited. And it's not if, it's when. So the last thing I wanted to remind you of is 2022 is coming up. And if you look at my website at terryfletcher.net, if you didn't get a chance to take a live seminar on all the Medicare regulatory updates, a live webinar, or if you are cardiology, gastro, orthopedic, please look at my website. I have all the webinars on demand. They come with a 1.5 CEU as well. So for anybody that needs CEUs the last part of the year, feel free to take a look at that. And also my code books are up. Again, cardiology, peripheral vascular, gastro, ortho, and we're now coming up with derm as well. So I do 8 specialties, but those are the main specialties that I do books for and on-demand webinars. So everyone, make it a great holiday. Have a wonderful Christmas, and we will talk to you soon, actually next week on the Codecast podcast. Everyone, make it a great day.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.